Those in line may be small in scale, but the demand certainly isn't. Thousands of children across Ontario braving the rain and any other trepidation to get their first dose of a COVID-19 vaccine. Good evening. These are the appointments many families have been waiting for.
But plenty of others are seemingly choosing to wait. And now the province is casting doubt on whether the shots could become mandatory for 5 to 11-year-olds. We begin our coverage with CTV's Queen's Park Bureau Chief Colin DeMello. Colin.
Well, Zarada, the Chief Medical Officer of Health, says Ontario doesn't have the data yet on the real-world effectiveness of the COVID-19 vaccine for those 5 to 11. He says that's one of the reasons why he doesn't want to make it mandatory for that age group. Even before the Christmas break, COVID-19 is creeping up. The 7-day average of new cases now stands at 692. 16 schools are closed due to outbreaks. And the Chief Medical Officer of Health is predicting it will only get worse.
This is a nasty, aggressive virus. This is the time of year where we expect an increase. And sadly, yes, we'll see increased cases in school settings, especially the elementary, where they haven't had the benefit of vaccine.
And you are so brave.
Which is why the COVID-19 vaccine for the youngest Ontarians comes at just the right time. And worries over the virus are driving up demand.
We have over 100,000 appointments already made. We're well underway to making sure that we get all of the children aged 5 to 11 vaccinated that are going to be.
But the number of bookings on the provincial website only represents 10% of the total number of eligible children in that age group. And at Queen's Park, there are calls to eventually make the COVID-19 vaccine mandatory for children and apply the same restrictions that other unvaccinated people face.
I do believe people need to get their vaccines. That should be a mandatory thing. You can't be safe in a crowd of people if you know that they're not vaccinated. I mean, it's pretty clear that the experts have identified that.
But Ontario's Chief Medical Officer of Health disagrees, saying the province doesn't have the complete data just yet, and some parents are understandably concerned, he says, about getting their children vaccinated.
We need prudence. We need time to review it before it would ever be part of any mandate. I think that's putting the cart before the horse.
But Dr. Moore offered a word of caution. Private businesses and sporting arenas could apply the mandate.
Any independent business can make a decision separate from government, but it would not be our advice at present to include it in any certification process.
Making it unclear whether unvaccinated children would be prevented from participating in vaccine-only activities. Dr. Moore says we are still in the fourth wave, but he cautions that Ontario is heading into colder, darker months as it pertains to the COVID-19 virus. He says, though, that the best way to prevent more school-based outbreaks is to get those young children vaccinated as quickly as possible. Reporting live at Queen's Park, I'm Colin DeMello. Back to you.